When we talk about health insurance, usually it's maybe UnitedHealthcare hits a snag, something like that.
Right, the usual ups and downs.
Exactly. But then sometimes something happens that makes those snags look tiny, like a real financial earthquake shaking the whole industry.
Yeah.
And that's what we saw on July 1st, 2025. Centene Corporation, huge player.
Right.
Just a sudden, massive market meltdown.
It was pretty shocking, even for this sector.
So today we're going to really get into what went down with Centene, especially this thing called risk adjustment, how that played such a big part. And then, what are the ripple effects? For other managed care companies, maybe even for the whole U.S. healthcare system, we're basing this on a really detailed article that was tracking this as it happened.
And it's important to remember, this isn't just stock prices fluctuating. This is, well, it's like a real-time stress test.
A stress test, yeah.
For an industry that, millions of people rely on for their actual healthcare. So it goes way beyond the financial news.
Definitely demands attention, and it got it right away. Let's hit the numbers first because they're pretty stark.
Yeah, they really tell a story.
July 1st, Centene just pulls its full-year financial forecast, completely yanks it.
Gone, just like that.
And the market reaction, immediate, brutal. Stock drops over 40% in one day.
40%.
Wiped out, $11 billion in market value? They'd been guiding around $7.25 adjusted earnings per share, their profit forecast.
A solid number, usually.
And then suddenly, nothing. No guidance, just silence.
Which is terrifying for investors.
So the immediate question everyone's asking is, what on earth caused that kind of collapse?
Well, Centene gave two main reasons. First, pretty straightforward, unexpectedly high healthcare costs, just more expensive than they planned.
Okay, that happens.
But the second one was more ominous, as you said. Worse than expected risk adjustment results.
Risk adjustment again? Okay, translate that. What does that mean for, the average person?
It means the people Centene covers through government plans. So, think Medicaid, ACA marketplace plans. These folks turn out to be, significantly sicker.
Sicker.
Yeah, and much more expensive to care for than Centene had budgeted for. The analysis we read used this really vivid, kind of brutal phrase.
Oh, yeah.
They said Centene became the financial equivalent of an involuntary organ donor.
Wow. An involuntary organ donor? That's dark.
It really captures it, though. The system, which is meant to balance risk, kind of turned on them because their assumptions were so off. They weren't just losing cash, they were losing their financial core, unwillingly propping up the system's imbalance.
That image is chilling. So, okay, let's unpack their business a bit. Their main thing, their bread and butter, is these Medicaid and ACA plans. Why does that focus make them so vulnerable here?
It's absolutely key, because these plans, they mainly cover lower-income people. And often these populations just have more health issues, more complex needs. They cost more to treat.
Right, that makes sense.
The issue seems to be that Centene's pricing, how they set their premiums, was based on projections that were just way too optimistic.
Optimistic like how?
Well, one report called it fairy dust and wishful thinking.
Fairy dust, okay. Not exactly solid financial planning.
Not really, no. And the proof came when the data rolled in from the states. 22 out of 29 state markets reported back, and the news was just ugly, consistently bad.
Ugly.
Higher costs than expected, worse morbidity, meaning more disease and illness, just a sicker group of people than they'd planned for across both their ACA exchange plans and their Medicaid business.
So the reality was just completely different from their forecasts.
Totally. Another graphic image from the source material, it said it's like opening your lunchbox and finding a dead rat in the middle of a sandwich.
Okay, yeah, that definitely paints a picture of a nasty surprise.
A really nasty surprise. Shows how far off base they were.
So the population being sicker is one huge factor. But you keep mentioning this risk adjustment thing. That seems to be where it really, glue up for them.
Yeah.
Can you break that down? It sounds technical, but important.
It is really important. And, yeah, it can sound complex, but the core idea is actually pretty smart, even if it causes headaches.
Right.
Imagine you're running an insurance company. You'd love to only insure super healthy people who never go to the doctor.
Right.
Saves you a ton of money.
The dream scenario for them, I guess.
Yeah, exactly. Well, risk adjustment is basically the government's tool to stop that, to stop the cherry picking of only healthy members.
Okay. Leveling the playing field.
Precisely. It moves money around. Plans that happen to get healthier than average members pay into a pool, and that money goes to plans that end up with sicker, more expensive members.
So it protects insurers who take on sicker people.
That's the goal, to make sure insurers are willing to cover everyone, not just the easy, low-cost ones.
Makes sense.
Now, the analysis we looked at said, for this system to work like it's supposed to, 3 things need to happen.
Okay, what are they?
1, the insurance company has to be pretty accurate in predicting how sick or risky its members are likely to be.
Okay, prediction. Got it.
2, the government can't suddenly change the rules or the calculations, move the goalposts while the game's being played.
Stable rules. Makes sense.
And 3, the company just can't mess it up. Their own internal systems and processes have to be working right.
Don't screw it up. Seems reasonable. So let me guess. Centene had issues with these.
It seems like they, as the source put it, biffed all 3.
All 3. Wow.
Yeah. Their members were costlier than they guessed. Their predictions were off. And critically, the money they got back from risk adjustment just wasn't nearly enough to cover that huge gap.
So the safety net failed them partly because they misjudged how high they were jumping.
That's a good way to put it. Yeah.
Okay, so disaster strikes Centene. How did Wall Street react? I'm guessing not calmly.
Oh, not at all. The reaction was immediate and pretty panicked. One analyst said Wall Street had all the calm and composure of a toddler who dropped their ice cream.
Ah, okay. I can picture that. Lots of noise. Probably some tears.
Exactly. Downgrades came flying in. Barclays, JP Morgan, Bank of America, basically everyone rushed to cut their ratings on Centene's stock.
Yeah, but it wasn't just Centene feeling the pain, right? This spread.
Absolutely. This is where it gets wider. Centene's implosion sent out what some called friendly fire.
Friendly fire.
Meaning other companies in the same space, their competitors, also got hit. Their stocks dropped too.
Like who?
Companies like UnitedHealthcare, Elevance Health, even Oscar Health.
Oscar, the sort of techie millennial darling insurer.
That's the one. They dropped like 15% just in sympathy because investors started thinking,
if Centene's pool is this bad.
Exactly. If Centene's Medicaid and ACA risk pool is, as one commentator called it, a swamp, then maybe the whole Medicaid ACA sector might be sinking too.
Oof, that's a huge worry.
It raises massive questions. What does this mean for everyone else's business model in this space? Are they all sitting on similar, maybe hidden problems?
The systemic risk, potentially. Okay, so Centene itself, they're facing this massive cost overhang. What's their immediate move? They must have to do something drastic.
Well, the most obvious lever they have is premiums. They basically have to jack up their prices significantly for the 2026 plans they're filing now.
Right. Got to cover those costs somehow. Seems straightforward.
But here's the nasty twist. Especially in these markets, Medicaid managed care, ACA marketplaces.
There's a catch.
There's a big catch.
Yeah.
If you raise premiums too much, what happens?
People can't afford it. They drop the coverage.
Precisely. And who are the first people to drop coverage when prices go up? Usually the healthier ones, the ones who don't think they'll need it as much.
Leaving. Only the sickest people. Oh, no.
Exactly. That's adverse selection. You're left with an even sicker, more expensive pool of members, which forces you to raise prices again. It's a vicious cycle.
The death spiral.
The dreaded death spiral. So Centene is absolutely cornered. Raise prices, you risk losing members and accelerating the spiral. Don't raise prices. Well, you lose your shirt financially.
That sounds impossible, like a lose-lose situation.
It's an incredibly tough spot, a brutal dilemma.
Is there any way out, any help coming? Could regulators step in, maybe extend those enhanced subsidies for ACA plans or boost Medicaid funding for states, something?
That's the huge uncertainty now. Could regulators send help? Maybe. They might see the risk to the whole system, the potential for lots of people to lose coverage.
So maybe some kind of bailout or support?
It's possible. Or they might just look at Centene's situation, the mistakes made, and say, you made your bed, now lie in it. Good luck with that.
Ouch. So no guarantees?
Absolutely none. The key takeaway here is Centene is no longer in control of its own narrative. It's bigger than their internal decisions now.
They're just reacting.
Totally. The analysis used another great image. They're playing insurance Hunger Games with a knife made of Jell-O.
A knife made of Jell-O? Yeah, that doesn't sound very effective for fighting your way out.
Not exactly confidence-inspiring, is it? Their ability to fix this on their own is severely compromised.
Okay, let's pull back from the corporate strategy in the stock market for a second. There's a human element here, right? Real people get their health care through Centene. Hospitals, doctors, they rely on getting paid by Centene.
Absolutely critical point. This isn't just numbers on a screen.
What could the fallout look like for actual patients and providers?
Well, it could get tough. If Centene is scrambling to save money, what might they do?
Cut costs. Maybe shrink their doctor networks.
Could be. Or maybe they start denying more requests for care, become stricter with authorizations.
Delay payments to hospitals and doctors.
That too. All of those are possibilities. And for you, the patient, what does that mean? It could mean higher premiums next year, definitely. Maybe losing your coverage if prices jump too much.
Longer waits to see specialists if networks shrink.
Exactly. Longer wait times, maybe finding it harder to get certain treatments approved, especially for people in those vulnerable communities who rely most heavily on these Medicaid and ACA plans. This could become, the new normal for them, unfortunately.
It just cascades down to the people who need care most.
It really does.
So, taking the 10,000-foot view then, what does this Centene mess really mean for the whole U.S. healthcare system? Is it just one company's bad luck and bad decisions, or is it something more?
I think the consensus is building that Centene is very much the canary in the coal mine here.
The warning signal.
Yeah. This specific crisis, it shines a really harsh light on some broader systemic weaknesses.
Like what?
Well, it confirms that, yes, Medicaid populations often are sicker and more expensive to cover than private insurance pools. That's a fundamental reality.
Okay.
It shows that the ACA marketplaces, while important, are still pretty sensitive to cost shocks. They don't have infinite capacity to just absorb massive cost increases.
They're fragile.
Somewhat fragile, yes. And it shows that risk adjustment, while a good idea in theory, maybe isn't always quick enough or strong enough to handle these big demographic shifts or prediction errors smoothly.
So the mechanisms aren't foolproof.
Not entirely. And maybe the bigger lesson is for insurers themselves, those who chased growth and profits by diving deep into these high-risk government programs. Well, they're learning that actuarial math can't be gamed forever.
Reality bites eventually.
Pretty much. You can't rely on fairy dust when you're insuring millions of people with complex health needs. This isn't just about Centene's specific mistakes. It reflects inherent stresses within these vital government healthcare programs.
And of course, the internet had its say immediately. Finance Twitter went wild, right?
Oh, instantly. The memification was fast and brutal.
What kind of things were people saying?
Stuff like, Centene just turned Medicaid into Mad Max.
Ouch.
Or, is Centene short for cent because that's all the stock is worth now?
Wow. Merciless.
Totally. But it shows how quickly a financial crisis like this becomes like a cultural moment online, which probably doesn't help Centene's efforts to recover trust either.
No, probably not. So wrapping this up then, the big takeaway seems to be that this Centene crisis, it's not really just about Centene, is it?
Not at all.
It's more like a serious warning shot about how fragile parts of the U.S. healthcare system are when they actually get put under real pressure.
That sums it up perfectly. Centene's massive stumble didn't just hurt them, it effectively, as the analysis said, drove the whole sector into a wall.
Hit the brakes hard for everyone.
Exactly. And the really big hanging question now is, does anyone actually have a roadmap out of this mess? Is there a clear path forward?
That is the crucial question, isn't it? Something for all of us, especially you listening, to think about that complex dance between the financial markets, government policy, and the healthcare we all rely on. It's a critical intersection, and clearly there's a lot more to untangle here.